This is LiveWell Talk on COVID-19. I'm Dr. Dustin Arnold, Chief Medical Officer at UnityPoint Health, St. Luke's Hospital. Today's weekly COVID update podcast we record at 8:30 in the a.m. on Friday, June 5th. We're rolling into June and restoration of services are taking place. People are becoming more active. Even with the recent demonstrations, social distancing is falling off, which is worrisome on a certain level, but we'll see how that plays out in the next couple weeks. Of interest, we've had 976 cases here in Linn County, but 79 deaths, and that's been stable for the last couple days. Totally in Iowa, there's 590 deaths. A majority of them are elderly patients in extended care facilities. Total cases in Iowa is right at 21,000. We started screening patients upon entry to the hospital on May 6th, and since that time, we've had 24 positives out of 2,212 tests. That was numbers as of yesterday. And I find that of interest because that's an asymptomatic rate that is much lower than what was predicted. There was predicted of a 70% prevalence. I think medicine and epidemiology has a lot of introspection to come back and say, why were the models so off as far as the prediction of prevalence and incidence? And part of that is that nobody had immunity, and so they really didn't know. As I've said before, I think the virus is attenuated to some degree, meaning it's become weaker as it's been around longer. It may just simply drift off. I'm not convinced that we will have a second spike in the fall. The comparison to influenza virus I don't think that's an accurate comparison. They're two different viruses, two different behaviors, two different antigenic drifts, and I do not think that is going to be an issue. I have been tracking the emergency department, the number of visits and the number of percentage of the cases that present being respiratory, and it's stayed stable at about 13% of patients each day showing up with respiratory concerns. And I'm convinced that that may be an early barometer of a surge returning with the restrictions being lifted for sheltering in place and social distancing, et cetera. Some updates, the sample acquisition clinic, which, as I've said before, I think the sample acquisition clinic will be reflected upon as one of the best things that we did, has moved to the old internist PC building on A Avenue, and I think that's 7th Street. But if you're a Cedar Rapidian, you say you don't go by streets, you go by what it's next to or what it used to be, because that's just the way it is. So it's the old internist PC building to me. But that's where the sample acquisition clinic moved to this week. Referral to the sample acquisition clinic is through your family practitioner or occupational medicine if it's work-related. Now, I get a lot of questions, and sometimes it's from very well-educated people that they don't understand that is a positive or negative test, meaning that on that day when you were tested, you had a positivity or negativity to a COVID-19 test. That doesn't mean that you could have had it in the past and you could have had it in the future. I think people have some misconception that the test indicates whether or not they've had it, and that is not true. We do have antibody testing that would tell you that, but we don't know what the value is because there is cross-reaction with the other coronaviruses, particularly 4 of them that cause the common cold. By the numbers, we're beginning to put together data. Our average ventilator duration of COVID-19 patients was 10 days, with the shortest being 2 and the longest being 27 days. And for people that aren't into critical care, greater than 10, greater than 20, that's a long time to be on the ventilator. The number of patients who received plasma transfusions is right at 13, and we continue in phase 3 of our surgical restoration with blood supply, pharmacy, critical care, and personal protective equipment remaining in the green. I do want to remind employees and associates that universal masking will continue and that you should wear a mask at all times when in the facility and if you're not able to socially distance. I think a mask will help with transmission, but a mask alone is not sufficient. I mean, if you built a chain link fence around your yard to keep the mosquitoes out, you'd still probably want to wear some insect repellent. So the mask by itself, you also want to add that with social distancing, washing your hands, and containment, the 3 C's, which we've talked about before. We know what we do and we know how we do it. It's times like these we learn the why. If you have a topic you'd like to suggest for the COVID-19 pandemic, please shoot us an email at stlukescr@unitypoint.org. In the meantime, wash your hands, cover your cough, and confine yourself if you're ill, and practice social distancing.